Good morning. Thank you, Mr. Chair. As Tony said, I'm working based in Cairo. I am the regional advisor for non-communicable disease in the regional office, and we are very pleased, me and my colleague, Marta, will be presenting the regional perspective in relation to palliative care and what's happening exactly in the region. I will try to be very short because I'm challenged also with the timing and the other gadget, which have never been used before. So I'm going to give you some perspective in relation to non-communicable disease and what is the situation of the palliative care in region and what we need exactly, how to move. When we talk about palliative care, we definitely talk about non-communicable disease because this is we always talk about integration of services and what is happening. Non-communicable disease, including cancer, is a major issue in our region. We have a 22 countries, and I will show you the map, how many starting from Afghanistan up to Morocco. The non-communicable, the 4 diseases like cancer, cardiovascular, diabetes, and chronic respiratory are a major issue in our region, although I'm expecting most of you think that communicable infectious disease is coming, but still we have in the poorest country, non-communicable are proceeding now and causing the highest mortality. One of the striking things in the mortality, unfortunately, it is a premature mortality. People, most of the country, if you see like in Tunisia, Egypt, Lebanon, it reach up to like 85% of death is premature. So this is an issue which needs a very real look at. In cancer is still not a big proportion compared with cardiovascular, but the striking thing is cancer is increasing. So based on what is that trend of tobacco, smoking in the region, and exposure for another factor, we are expecting to increase in cancer up to like 200% of the current situation. So like cancer mortality will go to double in 2030. This is the projection. Other things which is really unfortunate is most of the cancer cases occur before the age of 55 years, so it is not an aging sort of style of population. And also, most of the cases are presented in advanced stages, and this could be due to many factors why they are presenting in advance. Here in the slide, you could see that where we are going from 2012 and 2013, there is a double in incidence of cancer and double of mortality. When I speak about cancer and cardiovascular increase, I'm talking here about the need and the challenge of palliative care because there is a huge need in the area. This is the map which show you that what a country we are covering, starting Afghanistan, Pakistan, up to Morocco. And you could see in particular in the Gulf region, by 2030, there will be 200% increase in cancer incidence. So we are facing a major strike. What are the most common cancer in the region? Among female, by number 1 is breast cancer. All country, here we are taking Algeria out because Algeria belong to the Afro region, not EMRO. And most of the cancer is breast 1, is number 1. Among male, we have like the colorectal cancer is very common, lung and bladder cancer in some of the country. And these are a picture of smoking. Tobacco is a major issue in our region. The one which is very important for considering palliative care, the late diagnosis, advanced stage. I'm giving here breast cancer as example. You could see that majority of cases in Egypt and Saudi Arabia present in a late advanced stage compared with the state. What we do in WHO? As you know, WHO is one of the mandate is providing a leadership in area of healthcare. So on a regional level, as my colleague previously mentioned, that we have a global agenda for combating non-communicable disease as well as cancer. In the regional level, one of the major milestone, I think all of you know, is the 2011, the UN high-level meeting on non-communicable disease, where cancer has been discussed, as well as palliative care. In the region, we have transformed this into a sort of a regional roadmap. We call it a regional framework for action, taking all the commitment of the UN political declaration in 2011, and we put it in a regional framework. This is our roadmap when we follow with the country every year what they have done in these areas. So it is divided into 4 areas: governance, their plan, their prevention strategy, their surveillance, as well as healthcare. And within the healthcare, we focus on palliative care. So we assess the country response to palliative care on regular basis. In cancer, as I said, palliative care is one of the major issues. We provide, as a leading agency, WHO, we provide a technical advice and support on reviewing their palliative care program, and in providing them an assessment as well as a recommendation on palliative care. In addition to that, we look into cancer management as well as other diseases. So in area of cancer management, we want to see how they finance their cancer care, what they do in terms of how do they strengthen the palliative care. And that is done usually we do in a mission to the country, as well as we receive their document and work with the country in a close jointly to review their cancer situation and palliative care situation. Unfortunately, whatever has been done, I agree with my colleague, the resolution was a driving force, but we have been working before the resolution many times. There is a lot of effort which has been done before the resolution. There is increasing need in the region, building on what is the cancer situation and non-communicable disease situation. So I'm giving you example, like in 2008 and 2009, we developed a strategy for cancer. We look into the situation of palliative care in the region, and based on the situation, we decided to focus on 3 areas now. And I think these 3 areas is well reflected in the resolution, and we will keep working on them. One of them is the capacity building. There is a huge need for building the capacity of different level of staff in palliative care. There is a need to improve accessibility for pain management, and my colleague will talk about this. And we need to have a home-based community palliative care. Why? There is a uniqueness in our region. We did a survey with people about palliative care, and striking most of the country in our region, they prefer to have a home-based rather than institutional-based. Although most of the services now, it's a premature and provided in a hospital, we don't have like a hospice and things scheme. Most people, they prefer to go into a home-based, because the region is built on a concept of extended family, and people, they like to have their last few days and care done by their family at home. The key challenges in palliative care, the misconception. There is a very low conception among people themselves, the community, as well as the health provider regarding the concept of palliative care. There is not enough staff available to train the staff, a qualified staff to provide the services. We have a major issue regarding the legislation and accessibility of painkiller. It's a no-no in our region. So there is most of work to be done. And also there is the awareness I said in this area. We have done major work in working, as I said, in developing a standard guideline, working with HQ, working with our colleagues in other regions, as well as the people in Geneva. We're still working on the same block as you have developing a policy, training people, developing advocacy material, working with NGO. I should say NGO are a very strong advocate for palliative care in our region. Most of the work which is done currently is with the help of the NGOs in a partnership, whether with WHO or on a national level. Training is a gap in the region. We have a few. We've done a sort of a mapping of training available in the region. We have a huge gap still in the training in the region. So to move forward, we need to consider this issue based on the resolution as well as beyond the resolution. So we are still focusing on understanding the national need, the country need, what exactly how they utilize the services. And we agree with them on core service to provide it in palliative care. And the module of home-based, we have to focus on home-based. This is the preference in our region. We need to review the use of medicine and also engaging the non-governmental society. I hope I'm in time. Thank you very much for listening.